television. Live, local, late breaking. This is KOLD News 13 Now. Live.
For most people, the first doctor visit when your baby is born is to the pediatrician.
Yes, but for some other parents, one of the first visits is to the chiropractor. KOLD News 13's Barbara Grijalva brings us this special report.
You might think of chiropractic as always forceful, all the pushing and popping that people associate with it. But a Tucson chiropractor says that's not how it is at all when she works with children, even newborns. In fact, she says the pressure she uses is about what you would use when you squeeze a ripe tomato.
And there's this one. Good.
Meet Sebastian Peck. At 2 years old, he's a veteran of the chiropractic visit.
All of my children have been seen since birth.
Boy.
Chiropractor Dr. Michelle Roop Schweitzer specializes in babies and children.
So there's no twisting, there's no popping. It's not like what you see on TV or the movies. It's very low force, very gentle. And there's that big one in there. Has he been coughing? Mm-hmm. Yeah. He's definitely got him right in there.
Yeah, we all have
Dr. Michelle, as her patients call her, uses what's called a pro adjuster on Sebastian. It's a light tapping that Dr. Michelle says taps the vertebrae into place, taking pressure off the nerves, clearing interference between the brain and the rest of the body, putting the body back into balance, and preventing or treating problems.
Little pop. Pressure in this region goes to the lungs. And kids with asthma, those types of things, those vertebrae can really get stressed. Bowel movements, nursing, earaches. I have a lot of parents who have done rounds and rounds and rounds of antibiotics and are just wanting to add, something different into to see if it can't help. Very, very good response with that.
I bring my whole family in to see Dr. Michelle, mainly just to help boost their immune system and help keep them healthy.
When Sebastian was born, he had terrible trouble nursing.
There you go. And we came and saw Dr. Michelle, and it's like we had a brand new baby immediately.
Their problem starts at the base of their skull, and so it's a referred. The muscles all attached, the nerves all send up into the temporomandibular joint. And it's basically getting them to just open their mouth completely. Just that base of that skull. Yeah. Yes.
But some medical experts aren't sold. They say one wrong move could injure a child. Dr. Sally Evans is with the Children's National Medical Center in Washington, D.C.
The concern that I have is that some chiropractors, probably all chiropractors, are trained to do high velocity movements, but I think that some chiropractors have used them on children, and that's very, very dangerous.
Getting so big. Oh. I personally would never do that to a small child. In fact, when I work on the youngest, Sedona, it's going to almost look like I'm giving her a little baby massage.
That's 9-week-old Sedona Homan. Dr. Michelle has been seeing her since she was a few days old. Sedona's parents weren't totally sure about this at first.
Let's check your little feet.
After visiting with Dr. Michelle and seeing what she does and how gentle she is, I have no reservations.
It really helped Sedona to unwind from the birth process. Her legs were all curled up and she just was able to lengthen and stretch.
I mean, I'm just barely touching her. It's just the right movement along the muscle lines to just drop the vertebrae, and I felt a distinct body
Dr. Michelle believes making adjustments now helps prevent problems later. The parents say their children are different after their adjustments, both long and short term.
Yeah, she's definitely more laid back and relaxed, and I'll always go to sleep a little easier.
That usually means the adjustment really kind of relaxed him and everything set in, and they usually take nice, happy naps.
They always take nice, happy naps after an adjustment.
Safety studies show injuries are rare, but most of those studies involved adults and the higher impact manipulation. A few studies recommend more studies. Barbara Grijalva, KOLD News 13, live, locally breaking.